This is Beyond Borders, the immigration evaluation podcast, where you'll learn how to confidently conduct evaluations, connect with attorneys to gain referrals, and create a thriving practice. I'm Dr. Mariela Shibley, and I am here to help you turn your expertise into impact. Let's get started. As some of you might know, I am a psychoanalyst, in addition to being a psychologist, and I'm often asked, how does being a psychoanalyst influence how I perform immigration evaluations? And I think that's a great question, and I like it because one thing that I always say is that psychoanalysis is not necessarily something that you do. It's more really a way of thinking. It's a way of understanding ourselves, others, the world, etc. So let me just first distinguish a little bit about what psychoanalysis is, some of the basic tenets. And one of the things that's unique to this theoretical approach is our focus on understanding and reworking patterns that are oftentimes learned early on in life. So of course, this entails looking into our past, but not to just dig deep and stay there, really more to find its connection to the present circumstances. So it's not so much just where a behavior comes from, where we learn something, how we develop certain characteristics, but really more about what's understanding the function that they serve, which would then explain why we continue to do them nowadays, especially when they're not productive. So psychoanalysis, believe it or not, has a lot of focus on feelings and the ability to put feelings into words. And in addition to feelings, we focus on our defenses, the ways that we protect ourselves to preserve our self-esteem. And we all employ defenses. You might have heard of defense mechanisms, but really what it is just a way to protect ourselves, to protect our self-esteem from injury. And most of these, or many of these, are unconscious. We do it without thinking. It's very automatic. And it's something that most humans do. There's also a lot of focus on the therapeutic relationship. And the one thing that I would say, and this is how this ties into the evaluations, is how we tend to focus on the person and not so much the symptom. So whereas other therapies emphasize more focus on symptoms and behaviors, we really focus on trying to understand the person, their ways of thinking, their ways of viewing the world and themselves, and it's much less focused on a specific agenda. Like, for example, when I greet my patients, I usually greet them, hello. I don't really guide the conversation, certainly not in an analysis. But even in my sessions, I don't typically start sessions by saying things like, what would you like to talk about today? Or let's pick up on last week's sessions, or how was this week for you? Because that really guides the focus of the conversation. Now, some people might say, fine, but let me tell you, blah, 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 right? They just go into whatever it was that they were planning on talking about. But for most people, you can be perhaps derailing their focus, or perhaps there wasn't a focus, even better. They have nothing on their mind. And that gives place to be able to talk about whatever comes to mind. But when they have an agenda, it sometimes keeps them from being able to explore other areas, other thoughts, other feelings that are kept out of awareness because of this conscious agenda that they have in place. One of the things that I often say is what you do talk about is sometimes not as important as what you don't talk about, right? What we leave out. So shifting gears to the topic for today in these evaluations, a lot of psychological evaluations, the focus really is on the symptoms and arriving at a diagnosis. But I would say that my focus is absolutely not based on that. So I'm not just listening to see if they meet criteria for a diagnosis and what their symptoms are. I definitely explore that as part of the evaluation, but my goal is to really understand the person and who they are, how they think, how they express themselves, how they interact with others, if there are some patterns. I think it helps me go a little bit deeper when we're talking about the impact of trauma, or even when we're trying to speculate what the impact of a separation from a loved one would have on them. Because it's really not just about what symptoms they're experiencing or do they meet criteria for something. It's really more about who is this person? What are their coping skills? What are their tendencies? What are their typical defenses that I'm seeing already at play here? And how can I use those to explain how they were impacted by the trauma or how a separation from a loved one would affect them? So say you have a client who is a male who's applying for a VAWA, Violence Against Women Act, because they were abused by their spouse. And the male comes and is quite stoic and is not really endorsing many symptoms. And you notice a tendency to minimize and to present themselves with a stoic front. A lot of people will go down the route of explaining it from a cultural perspective, right? So they can talk about that culture and specifically how males view certain things as a weakness and how he's probably trying to, protect his self-esteem. And that's why he's not endorsing that many symptoms. And that might be accurate, but it may not. But if you hear their upbringing, the quality of their interpersonal relationships, you might actually pick up on some characteristics or some defenses that actually explain that stoicism from a more personal, individual perspective. So, for example, a man whose father died when he was very young, when he was 10 years old. And of course, that loss wasn't adequately processed. And immediately he learned that he had to be strong for his mother. He had to take over the role of the male of the house at age 10. So vulnerability was not invited in the house because vulnerability implied a weakness. And this wasn't because of cultural stigma, which may have had some influence, but it was because of this man's past experiences that shaped his personality and his way of being in the world. Now, in the report, you don't have to get into details about everything. You don't have to explain what happened, but just enough to where you can say something like, he described a childhood where he had to grow up fast and toughen up to be strong for his widowed mother. And he was praised for his stoicism. So it's no surprise that he would attempt to maintain a stoic front in this situation. Again, that doesn't mean that he wasn't affected by it. It's quite the opposite, because the abuse eroded his self-esteem. And it hurt him so much that it forced him to have to employ that unconscious defense to protect himself. He would not need the protection if he hadn't suffered. So again, this confirms that he was indeed victimized. If you're ready to grow your income and impact, head to the link in the description box to learn more about my training program. For now, let's get back into the episode. So back to psychoanalysis. Focus on how the individual's early experiences shape their ways of being within the world with others and how they view themselves. And people's suffering can manifest in many other ways that go beyond symptoms. We see it in the choices that they make in life, in their personal views, how they relate with others, what they tell themselves. A person whose mantra is "don't trust anybody" clearly learned that from a painful experience. It could align with some cultural values in some societies, but that doesn't explain it, because otherwise, how would you explain why other members of that culture don't have those characteristics? So I think it could influence someone's manifestation of suffering, but it doesn't necessarily explain it. So the focus is on the person, and in this evaluation, that strengthens the report. It makes it have so much more power because you're not just speaking in general terms. People in this culture tend to blah, 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 where the adjudicator might say, okay, but how do we know that this person fits with that description, right? How do we know that this is the case? But when you're being more specific, when you're exploring their upbringing, you can say that with a lot more certainty that this is what explains their presentation today. Another thing that I've come across a lot is people who've experienced trauma that went unprocessed. I always say it's not so much what happened, but how the person experienced it and whether or not they got the opportunity to process it, to talk about it, to understand it, to express their feelings, and to be contained, to be supported. When individuals don't have that experience, that trauma gets pent up inside them. It doesn't go anywhere. You probably already know this if you're a mental health professional. But say a person comes in and will say, yeah, my mom died when I was 5, but I don't really remember. Well, that's quite possible. But the reason they don't remember is what's really meaningful. It's not just because it was a long time ago and they were young. Events like that kind of stick with you. So I ask questions. What did they tell you that happened to your mom? Did you understand what was going on? Who cared for you? And surprisingly, they're able to remember those things, and they might say, no, I just went, with my aunts and with my grandmother, and yeah, one day they just dressed me up and we went to the funeral and everybody was crying, but yeah, it was a long time ago. Now, if you have a 5-year-old, I have kids, and my kids were 5, and to me, that really elucidated a lot of how a child's mind works. I can guarantee you that a 5-year-old understands what's going on around them, has a lot of feelings about it. And that's also paired with the fact that at that age, they're very egocentric. They think everything's about them. And they have a tendency to blame themselves for things that happen, as unrealistic as that might be. And so this is something that oftentimes just gets buried and carried on through life. And this person's here now at 35 saying, I don't really remember. Yeah, that's totally fine. Well, that is a major loss that could have been experienced as abandonment. We don't know. So when you're evaluating this person, especially if it's for a case where there's a potential for separation from a loved one, this is major. Even though what they're saying, I don't remember and I'm totally okay with it. You can see it in other behaviors, in difficulties trusting others. Or maybe not trusting others, but difficulties around intimacy. Maybe a more avoidant attachment style where they seek closeness, but they fear that rejection or that abandonment. So they kind of maintain a distance. And that person could very well also present a stoic front and say, well, somehow we'll make it work, right? Or when you ask about what would happen, they focus really more on practical hardships of how it would affect them financially and practically, like who will care for the kids, etc. But their mind doesn't automatically go to the emotional aspect of it. Their mind doesn't make that connection of, wow, I guess you'd be removing a parent from my child's life, much like a parent was removed from my life when I was little. And it's not because they don't want to. Their mind just doesn't make that connection, and that's because it protects itself. The very primitive way of protecting oneself that we develop early on in life. So those are just a few things that I can think of that where my identities sort of merge. I'm being a psychoanalyst and how I listen to people, how I interpret situations, and how I use that to answer a referral question. So it's going beyond the surface, going beyond just the symptoms and whether they meet criteria or not for a diagnosis, or whether something can be explained from a cultural perspective. All those things are super important, but I think having this analytic perspective allows me to go a little bit deeper and think a little bit more, not necessarily outside the box, but to really consider other nuances that perhaps would otherwise go unnoticed. So that's all I have for today. I hope you enjoyed it and found it interesting and stimulating, and I will see you next time. I appreciate you spending time with me today. Make sure to subscribe so you don't miss the next one. And if this episode helped you, share it with a friend. See you in the next episode.